Hi everyone, this is my week 10 flashcard on urinary tract infection, or UTI. This usually refers to a bladder infection, but it could actually refer to any infection in any organ of the urinary tract, including those in the lower portion, the bladder, in the form of cystitis, the urethra, or urethritis, the prostate in men, or prostatitis, or in those in the upper portion, including the kidneys, in the form of pyelonephritis. These are typically referred to as lower UTI and upper UTI, respectively, and virulent bacteria, typically from the perianal area, invade and adhere to the mucosa of the affected organ via fimbriae or pili. The affected mucosa wall becomes inflamed, red, swollen, and sometimes ulcerated. Pyelonephritis results in the formation of exudate in the kidney pelvis and calluses, with medulla inflammation, necrosis, and abscesses. In severe infections, exudate may compress renal arteries and veins, obstructing urine flow and leading to acute renal failure. The most common organism that causes UTI is E. coli. Uncomplicated UTIs involve those that occur in females with no anatomical abnormalities or comorbidities, whereas complicated UTIs are those that involve males, pregnant females, obstructions, hydronephrosis, structural defects or fistulas, immunocompromised patients, the elderly, atypical organisms, and certain procedures or treatments. Risk factors for UTI include women. Women are more at risk of UTI due to the proximity of the urethra from the anus. Improper hygiene, women who wipe back to front are more likely to get a UTI. Sexual intercourse, baths, these activities cause irritation to the urinary structures, particularly the urethra. BPH in men, congenital abnormalities, the elderly, incontinence, particularly fecal incontinence, urinary retention, obstruction, pregnancy, scar tissue, renal calculi, immunosuppression, diabetes, procedures involving instruments or catheters, STIs, particularly with urethritis, and chronic Foley catheter. Major signs and symptoms of UTI include dysuria or painful urination, frequent urination with shorter intervals in between, urgency, nocturia, cloudy, malodorous urine, lower abdominal pain, and it may be associated with conjunctivitis and reactive arthritis. Complicated UTIs involve fatigue, fever and chills, leukocytosis. Classically, we see delirium in the elderly, DKA. Sometimes UTIs are asymptomatic, especially in pregnant females, and may be associated with sepsis. Diagnostic testing for UTI includes a urinalysis, which typically shows bacteriuria, pyuria or pus in the urine, hematuria. There's often nitrites, and the presence of urinary casts will be present in pyelonephritis. Urine culture and sensitivity will isolate the organism, and typically infection is considered greater than 10 colony-forming units present. In complicated and severe UTIs, blood work may show leukocytosis, elevated creatinine in acute renal failure, or bacteremia in urosepsis. And that's it.